My name is Dr. Richard S. Lee. I am a neurologist and sleep medicine physician at the Intrepid Spirit Center, Fort Carson. I'm also a clinical director. A neurologist is a specialist branch of internal medicine that evaluates, diagnoses, and treats diseases of the nervous system, the brain, spinal cord, peripheral nerves, and muscles. So we initially evaluate, examine, diagnose, and treat them for all of the symptoms they have. The symptom complexes they have are related to direct or indirect injury to their brains, and they wind up with both physical, mental, psychological, and spiritual injuries as a result of the trauma. And we can handle all of that here at the Intrepid Spirit Center. When I arrived here in 2016, I was faced with the reality of being in two quote temporary buildings because that's the only space that was available. When I was here for an interview in 2015, Captain, at that time, Dr. Pasden, kind of lured me here to tell me about the new building, the Intrepid Spirit Center, showed me pictures, blueprints, and said we'd have one very soon. That was 6.5 years ago. Today is the day, so we have much more space, we have more efficient and modern facilities, and we have better equipment in order to treat and rehabilitate our patients here. One patient comes to mind who I've been treating now for a little over 1 year. He is a NCO, first sergeant, who was struck by a vehicle very near the post. He ran out in the middle of the road to pick up something that fell off his vehicle. He was struck at high speed by a vehicle and unconscious, of course. He was initially taken to hospital for acute treatment. He had to have surgery done to remove a blood clot on the surface of the brain. After he left the hospital, he came to us for evaluation and further treatment and rehabilitation. At first, he had very little insight into his problem because he had frontal lobe damage, which often affects people's ability to understand what's wrong with them. So he didn't think there was much wrong with him, but he had trouble speaking. His speech was stilted. He couldn't perform executive functions or sequential things, and he was a man who was in a position of authority prior to this. So we started working with him. He saw all of our rehab specialists for evaluation. They began treating him in spite of some of his resistance, because again, he didn't have much insight into the limitations he had, intellectually and physically. So in addition to his head injury, he suffered fractures and injuries to his spine, pelvis, and a few other areas of the body. After about the first 6 months or 8 months of treatment, he improved significantly. Pain levels came down. Our team helped him tremendously as far as his speech, language, cognitive functioning, physical functioning, and sleep issues. He began to develop more insight when his brain healed into still the limitations he had. But he wanted to continue to take a sergeant major course, which he already signed up for. He realized this was the only opportunity he would have. If he didn't take it this time, they wouldn't offer it again. He'd probably have to discharge from the military. He's taking it remotely, and he's doing very well. Over the next 3 or 4 months, he became one of the best pupils in his course and improved significantly intellectually, psychologically, and physically. And he's almost at the end of his course. I think he has one more section to perform. And the neuropsychologist here tested him and found that his improvement from when he first came in was dramatically better. And overall, he's doing much better in his life, daily functioning. And he's hoping to finish his sergeant major course and remain in the Army. When I first saw him a year and 2 months ago, I thought he would never return to duty, even with our best efforts. But it looks like he probably will. Well, it means quite a lot to me. I spent most of my career in the private sector as a civilian physician, and I enjoyed it immensely. But then I retired for the third time, and it didn't stick. And I got a job working at the traumatic brain injury, with traumatic brain injury veterans at the Tucson VA healthcare system for 6 months, just filling in. I enjoyed it quite a bit, and I told my wife I was thinking of going back to work for the military or the VA. And this opportunity arose, and I came for an interview and took it. But I think what I've learned most here is that I have gained more than I've given here for most of my patients. They've taught me more than I've taught them, I think. As far as resiliency and adaptability, and most soldiers are trained to push through and finish the job, and that's what most of them do. So I've learned quite a bit. It's been a great experience. It's been a privilege working here, actually. And I have a few more years left, probably, God willing. But I think that the service that they perform, they deserve the best care possible. And that's what we try to do here.